Across all entities with CentraCare, we have over 150 people working in the supply chain departments that service our hospitals with the movement of goods and services and the purchasing of all the goods that we have and use.
So typically we source products through national manufacturers. They're well-known name brands that are used across the country. Since COVID-19, we've recognized the importance of maintaining those local relationships for situations like these, where communities come together, organizations across the state coming together to really help one another. And the outpouring from the community has been amazing.
One of the first things that stopped showing up when the outbreak started was our face shields. Face shields which are used to protect our healthcare workers from any splatter or aerosol from a procedure that they might be doing on a patient. When word got around that face shields were running in short supply, a company, a maker's company out of Northeast Minneapolis actually reached out to us and offered to print us out shields and then give them to us for free. And about the same time, St. Cloud State also contacted us saying, hey, we've got 11 3D printers that aren't doing anything right now. The kids aren't taking classes at the building, so you can use those however you wish. Let us know what you need. It's been quite an amazing process. I can call up just about any company in town and ask them for something, and they just offer, how can I help? It's just like that.
We had gotten to the point where we were bringing in hand sanitizer in the drum, and we were going to bottle it ourselves. We found out there's a company here in St. Cloud, ePromos, who had sanitizer but no bottles. We had extra bottles, but no sanitizer. So we came together and we were able to have them fill our bottles. It really changed the game for us in hand sanitizer. Before we connected with ePromos, we were really getting low on that supply and trying to think of, okay, what can we do? So when we partnered with ePromos, it was huge. Not only did they fill about 5,000 of our empty bottles, but they also gave us an opportunity to purchase nearly 9,000 additional bottles. So for our organization, that was a huge win, and allowed us to kind of step back from hand sanitizer and now focus on things like gloves.
It's not a good thing in the supply chain if one of the facilities guys is driving his car to pick up medical equipment. But we're doing what it takes to get volunteer donated items here. And it just shows that when the supply chain does hiccup, we can find the resources locally, and we just do whatever it takes. And there's a lot of people working really hard to make sure all of our healthcare workers have the supplies they need.
One of the things over the past month and through this experience that surprised me the most is just how ready our teams were. Obviously, there's a tremendous amount of gratitude that's going out to every level and every position in this organization. Specifically to the logistics team. They're the folks that work down on the B level, and they're the unseen people day in and day out, taking the product off the back of the truck and making sure it's available. And they do good work every day. But I think this has highlighted the good work and the good people they are.
Everyone's that I've worked with has been really committed to helping, because I think they see CentraCare as the community, just as we see them as our community.